All right, let's dive in. Today we're tackling something uh, pretty fascinating, maybe even a little bit complex. Psychotherapy and psychosis.
Oh, this is going to be good.
We're exploring this book. It's called Psychotherapy of Psychosis.
Okay.
It was published a while back, in 1997,
Mm-hmm.
by the Royal College of Psychiatrists.
Right.
Edited by Chris Mace and Frank Margison. Now, this book is really cool because it doesn't just focus on one way of doing things.
Yeah.
It explores how all sorts of different approaches, all these different schools of thought, from psychodynamic therapy to CBT, even family systems therapy,
Yeah.
how do they all tackle this challenge?
Right, right. Because you think, how can all of these be used to treat psychosis? They seem so different.
Yeah, that's exactly what we're going to explore.
I love it. So one of the things that I think makes this topic so interesting is that the definition of psychosis has actually changed a lot over time.
Really?
It used to be this incredibly broad term. It was almost like a catch-all for any serious mental disorder. And so early psychiatrists, folks like Kraepelin and Bleuler,
Oh, yeah.
they really tried to categorize these illnesses.
Oh,
And a
yeah.
lot of times they were really looking for physical causes.
So they were looking for something tangible, like, oh, there's a lesion on the brain that's causing this.
Exactly. But, as research progressed, the focus kind of shifted more towards understanding the psychological and even the experiential aspects of psychosis.
Right.
And, even today, we still have a huge amount that we don't know about what causes it,
Mm-hmm.
which makes treating it even more challenging because you're trying to treat something
You don't even know what's causing it.
that we don't fully understand.
It's like trying to solve a puzzle, but you're missing half the pieces.
Right.
So how do these different approaches even begin to think about approaching therapy for something so complex?
Well, I think each approach kind of offers this unique lens through which to view and treat psychosis.
Right.
So take psychodynamic approaches, for example. They go really deep, right? They delve into the unconscious mind, exploring how early childhood experiences and maybe even unresolved conflicts might be influencing later psychotic experiences.
So we're talking Freud, Jung, Klein, Winnicott, all those ideas of those really formative early years.
Yes.
Yeah.
And how they might be shaping our understanding of psychosis later in life.
Fascinating.
Yeah, Freud, for instance, he viewed psychosis as this kind of breakdown of the ego's defenses,
Oh, okay.
resulting in this overflow of primitive urges and anxieties. Jung, on the other hand, he saw it more as a disconnect from conscious reality, like a journey into the unconscious that could potentially hold some symbolic meaning.
Wow, those are so different. But I mean,
Yeah.
how practical are these approaches in actually helping someone who is in the midst of a psychotic episode? It seems like focusing on stuff that happened in childhood might not be addressing their immediate needs.
Yeah, and that's a really valid point. And actually, that's one of the main criticisms of psychodynamic therapy.
Hmm.
Critics will argue that it's difficult to form that therapeutic alliance with someone who's really in the midst of an episode because they might be really distrustful, they might be withdrawn, or they might just simply not be able to engage in that kind of introspection that psychoanalysis often requires.
It's like a catch-22.
Yeah.
You need to understand their inner world to help them, but their very condition is preventing them from letting you in. So are these approaches more about understanding the roots of psychosis rather than providing practical tools for managing it?
Not entirely. I mean, while traditional analysis might not always be feasible, I think the insights that we gain from these approaches can be really valuable.
Okay.
For example, understanding a patient's early experiences might help a therapist tailor other forms of treatment, like, say, cognitive behavioral therapy,
Oh,
to their specific needs.
so it's less about digging into the past to find a cure and more about using those insights to inform a more holistic approach to treatment.
Exactly.
Makes sense.
And I think this is where a model like the one used at the Castle Hospital becomes really interesting because they do this. They combine elements of psychodynamic therapy, systemic therapy, and behavioral therapies
Oh, wow.
to create a more kind of comprehensive treatment plan.
That sounds really unique.
It is. And one of the things that's key about the Castle Hospital model is that they actually work with the whole family,
Really?
not just the individual.
Oh, interesting.
Because they recognize that family dynamics play a huge role in both the development and the management of mental illness.
That makes sense.
Yeah.
Families are these incredibly complex systems with all their own patterns of communication and ways of interacting. It seems pretty intuitive that those dynamics could influence someone's mental health, right?
Absolutely. And that's actually why they offer these residential programs where families can actually live together in a therapeutic community,
Wow.
which allows therapists to really observe these dynamics firsthand and work with the whole family to create a more supportive and understanding environment.
That's incredible. It must be so intense for everyone involved.
It is.
But I can only imagine it leading to some really, really profound breakthroughs.
Yeah.
So it's not just about treating the individual. It's about treating the entire family system as a unit.
Precisely. And it really highlights this understanding that psychosis doesn't exist in a vacuum.
Right.
You know, it's really deeply interwoven with the individual's relationships and their social context.
This is also fascinating. It seems like this book is really pushing the boundaries of traditional thinking about psychosis
It is.
and offering some really innovative and compassionate approaches to treatment.
Absolutely. And while, the field has continued to evolve since this book was published,
Of course.
a lot of the insights and the techniques that it presents are still so relevant today.
All right. So we've talked about how the very definition of psychosis has changed over time, the role of early childhood experiences, and this incredible integrated model they use at the Castle Hospital. But the book doesn't stop there, does it? It also dives into some really compelling case studies
Yes.
that bring all of these theories to life.
Oh, absolutely. And these aren't just, clinical examples. These case studies offer us a window into the lived experience of psychosis, the struggles and the triumphs of therapy and this remarkable resilience of the human spirit.
I'm ready to be moved and inspired.
Yeah.
Let's delve into those case studies and see what we can learn from the real-life journeys of individuals and families navigating the complexities of psychosis.
Okay, so let's start with a case study that I think really explores this idea of the power of language in understanding psychosis. Dr. Murray Cox, one of the contributors to this book, uses this really fascinating literary analogy.
Okay.
He describes this patient, a woman who had a psychotic episode after her glasses were damaged. And she becomes terrified that she's going blind. And this fear kind of manifests in these really unusual ways. She talks about feeling like she's dissolving.
Dissolving. Wow, that's a powerful image. Suggests a loss of boundaries, a sense of fragmentation.
Exactly. And Dr. Cox argues that, we need to look beyond just the surface meaning of the words that someone is using during a psychotic episode.
Okay.
We have to consider the emotional context. Like, what are the underlying fears and anxieties that might be driving their language?
It's like you're trying to understand a poem or a dream, right?
Yes.
You're looking for those hidden meanings and symbolic connections.
Exactly. And he even calls these moments passwords to the psychotic's inner world.
I like that.
But these passwords aren't, literal words. They're more like glimpses into the person's internal experience.
Right.
A way of communicating their distress and trying to make sense of a world that feels really chaotic and overwhelming.
So even when someone's words seem, nonsensical or disconnected, they're still trying to tell us something important about what they're going through.
Precisely. And I think this approach requires so much empathy and attunement from the therapist, right?
Yeah.
It's about recognizing that, even when language becomes fragmented, even when it seems really illogical, there's still a person in there trying to connect, trying to communicate their unique experience of the world.
That's a powerful reminder.
Yeah.
And not just for therapists, but for all of us, to really listen and try to understand the deeper meaning behind someone's words.
Absolutely.
Especially when they're struggling. Okay, so shifting gears a little bit.
Yeah.
There's a case study by Dr. David Taylor who discusses the challenges of treating a patient with borderline personality disorder who also experienced psychosis.
Right.
I'm really glad we're talking about this because I think it's important to understand that psychosis isn't always a standalone condition, right?
Right.
It can coexist with other mental health challenges.
Yeah.
Which I imagine adds another layer of complexity to treatment.
Absolutely. And in this case, Dr. Taylor really highlights this interplay between the patient's borderline dynamics and her psychotic experiences. He describes this woman who was consumed by fears of abandonment, and she had a history of unstable relationships. And during therapy, she starts having these visual hallucinations of children.
Interesting. It seems like those hallucinations could be connected to her fears of abandonment, maybe representing a longing for connection or a fear of losing loved ones.
That's exactly how Dr. Taylor interprets it. He sees those hallucinations as a symbolic representation of her childhood anxieties and unresolved emotional pain. And I think it highlights this idea that when we're treating psychosis, we really need to understand the individual's unique psychological landscape, right?
Yeah.
You can't just focus on the symptoms in isolation.
Right.
You have to see how they connect to the person's life story, their relationships, their deepest fears, their desires.
Like a detective novel. Piecing together clues from the past to try to understand what's happening in the present.
Yes.
But I mean, doesn't this raise some questions about whether, like, psychoanalysis is even appropriate for someone with borderline personality disorder?
It does. And Dr. Taylor even acknowledges that traditional psychoanalysis can be really challenging for people with BPD because they often experience the therapist's neutrality as rejection or abandonment.
Oh, wow.
Which can actually worsen their symptoms.
So the therapy itself could unintentionally be triggering those very fears that they're already struggling with, those deep-seated fears of being alone or rejected.
Exactly. And that's why many therapists who work with borderline patients take a more kind of supportive and relational approach.
Right.
They understand how important it is to provide that really secure base, to offer consistent empathy, validation, and to create a therapeutic relationship that feels safe enough for the patient to explore those really, really painful emotions.
That sounds like a really delicate balancing act.
Yeah.
Providing support and structure without triggering those intense fears.
It is. But, as Dr. Taylor's case shows, I think it is possible to find that balance and to help someone who's struggling with both BPD and psychosis to move towards healing and stability.
Okay, so we've talked about some cases that really highlight psychodynamic and literary approaches to understanding psychosis. What about examples of how family dynamics can influence these experiences?
Yeah, that's a good question. Let's shift to Dr. Roger Kennedy, who really talks about this Cassell Hospital approach to treating the whole family, right? One case that really stood out to me was involving a mother experiencing severe postpartum depression and how her illness impacted her relationship with her baby.
Yeah, postpartum depression. I mean, that's a topic that deserves so much more attention and understanding.
Oh, absolutely. It's such a vulnerable time for new mothers. And, when mental illness enters the picture, it can feel so overwhelming.
Totally. And what's so powerful about the Cassell Hospital approach is that they create a space for the entire family. They really recognize that a mother's mental health can have this ripple effect.
Impacting the baby's development, the overall family dynamics.
So instead of isolating mother, like, oh, you have this problem, we need to fix you, it's bringing the whole family in and saying, okay, let's look at this as a whole.
Exactly. They understand that to truly help the mother, they also need to address the fears and anxieties of the father, the potential impact on the baby, and the overall family system.
It's about recognizing that a mother's well-being is intertwined with the well-being of her family, and that healing happens within those relationships.
You put it perfectly, and Dr. Kennedy really emphasizes the importance of understanding attachment theory, particularly the complexities of that mother-infant bond.
Right.
He describes, for example, how a mother struggling with postpartum psychosis might project her own fears and anxieties onto her baby.
So the baby becomes a kind of mirror, reflecting the mother's own internal turmoil. That's got to be so difficult for everyone involved.
It is. And this can actually lead to a vicious cycle where the mother's distress kind of amplifies the baby's distress. Oh, wow.
Further fueling the mother's anxiety.
It's heartbreaking to think about, but it sounds like the Cassell model offers a way to interrupt that cycle, to create a safer and more supportive environment.
Exactly. And this case also really highlights how critical early intervention is.
Right.
The sooner these families can access support, the better the chances of preventing those long-term negative consequences.
It makes you wonder how many families out there are struggling in silence, feeling ashamed or afraid to seek help.
Yeah. I think there's still so much stigma around mental illness, especially postpartum depression. That's why these conversations are so important. And it's so crucial to make sure that resources and support are readily available to families who are in need.
It's a reminder that we all have a role to play in creating a more compassionate and understanding society when it comes to mental health. So there was another case study that I thought was pretty striking. It involved a mother with Munchausen syndrome by proxy.
Right.
Dr. Kennedy describes how this mother was essentially inducing illnesses in her child. Wow.
To gain attention and sympathy from medical professionals.
That's really disturbing. It's just this reminder of how complex and multifaceted mental illness can be,
Yeah.
it's almost like the mother's own psychological needs
Right.
are being met at the expense of her child's well-being.
It's a tragic example of how distorted thinking and unmet needs can lead to these really harmful behaviors.
But I'm also curious, like, how did the therapists at Cassell even begin to approach this? I mean, this had to be incredibly challenging.
It was, but, they recognized that simply stopping the mother from harming her child wasn't enough.
Right.
They needed to understand the psychological dynamics that were driving her behavior.
So it's getting to the root, not just addressing the symptoms.
Exactly. And the Cassell model, with its focus on family therapy and understanding those complex dynamics, provided a framework for doing just that.
It's a reminder that even in like the most challenging cases, there's always hope for healing and change. Okay, there's one more case study that I want to discuss before we move on.
Yeah. It involves a mother with schizophrenia and her 10-year-old son.
Right.
What were your initial thoughts on this one?
Well, I think this case is especially poignant because it highlights those immense challenges faced by parents with severe mental illness who are trying to raise children.
Right.
This mother, she was struggling to manage her own psychotic symptoms while also trying to care for her son.
Right.
And the son, understandably, was really affected by his mother's illness.
Of course.
He experienced fear, confusion about her unpredictable behavior.
It's heartbreaking to imagine what that must have been like. It's a reminder that mental illness doesn't just impact the individual. It has a huge ripple effect on everyone around them, especially their children.
Yes. And this case, I think, really underscores the importance of providing support, not just to the individual with the mental illness, but to their families as well. And the Cassell Hospital recognized this.
Yeah.
And they offered therapy to both the mother and son, helping them to understand and cope with the mother's illness.
And the fact that they could work with this family in a residential setting, that must have been so beneficial. Right?
It was. Having them living together in that therapeutic environment allowed therapists to really observe their interactions firsthand and tailor the treatment to their specific needs. Dr. Kennedy even describes how the therapists acted as like these auxiliary egos for both mother and son.
Interesting.
Providing that support, the guidance, a sense of stability.
It's like they stepped in to fill those gaps.
Yeah.
Offering a lifeline when it was really needed.
Exactly. And I think this case just really beautifully illustrates how that kind of intensive, holistic approach, like the one at Cassell, can make such a profound difference.
All right, so we've explored all these different case studies, each one shedding light on different aspects of the psychotherapy of psychosis. But there's one more section I really want to get to before we wrap up this deep dive. The part that focuses on integrating all these different therapeutic approaches. I'm really curious to hear your take on this.
Me too. This is where it gets really interesting, right? This is where theory meets practice. It's one thing to talk about all these different therapies in isolation.
Right.
But the real challenge is figuring out how to blend them effectively in real-world clinical settings. And that's exactly what this last section tackles head-on.
Yeah, it's like one of those cooking shows where they take like all these different ingredients and somehow create this amazing dish.
Yeah.
And you're sitting there like, wait, how did they know that those flavors would work well together,
That's such a good analogy. And I think, like, finding that perfect balance is a big part of what makes integration so challenging.
Right.
Different therapies kind of come with their own baggage, right? Their own set of assumptions about how the mind works, their own language, their own ways of understanding the world.
So it's not just combining like techniques or tools. It's almost like integrating different worldviews.
Exactly.
Wow. That must lead to some pretty interesting conversations, in the therapist lounge.
Yeah, I can only imagine. But I think the therapists who are really good at this, who can really integrate these approaches successfully, are the ones who can hold multiple perspectives at the same time, who can be flexible, shift between different theoretical frameworks and really tailor their approach to the needs of that individual or that family.
It sounds like it takes a very special kind of therapist to pull that off.
It does.
I mean, does the book offer any guidance on how to actually do this? Like, how do you achieve this integration?
It does. And, one of the models that it highlights is, of course, the Cassell Hospital approach, which we've been talking about. They're not just using psychodynamic therapy, systemic therapy, behavioral therapy kind of side by side. They're really weaving them together to create this more holistic, more comprehensive treatment plan.
So it's about finding those points of connection, where those different theories and techniques can actually complement and enrich each other.
Exactly. And something that's so crucial to the Kessel model is this emphasis on creating this therapeutic community.
Right.
The space where patients and families feel really safe, supported, and empowered to actually engage in that really challenging work of healing and growth.
That kind of environment must make a huge difference. It's not just about those one-hour therapy sessions.
Right.
It's about creating a whole culture
Yes.
of support and understanding that goes way beyond the therapy room.
Absolutely. And I think it goes back to what we were talking about earlier. It's so important to address the complexities of psychosis on all these different levels.
Right.
It's not just about targeting those symptoms in isolation. It's understanding that individual psychology,
Right.
their family dynamics, their social context, and creating a treatment plan that takes all of these factors into account.
It's about seeing the whole person, the whole system, and recognizing that healing happens at the intersection of all of those different dimensions. This book has given me so much to think about, so many new insights into how we approach mental health.
Me too. And while the field has certainly advanced since this book was published, those core principles are still so relevant today. I really think Psychotherapy of Psychosis reminds us that even when we're dealing with something as complex and challenging as psychosis, there's always hope. There's always that potential for growth and transformation. And it encourages us to keep searching for those innovative and compassionate ways to support individuals and families on their journey towards healing.
This has been a truly incredible deep dive. Thank you so much for guiding us through this complex and often misunderstood topic.
My pleasure. And to everyone listening, I hope this conversation has sparked some new insights for you. Maybe even encouraged you to think a little differently about the complexities of psychosis and the incredible resilience of the human spirit. If you're interested in learning more, I highly recommend checking out the book itself. It's definitely worth a read.